Hiya ako sa'yo. Guys, welcome back to my channel. Well guys, nandito pa rin ako sa vintage teapot and kasama ko pa rin si Golda. And now we're gonna discuss about nursing home. Marami sa inyo nagtatanong about the experiences sa nursing home and we can only ask somebody na nag-work doon. Ito na siya. Hi ulit Golda, kumusta?
Hello!
Ano pala natin nakita?
Oo nga. 48 years.
Oo, 48 years. Ngayon Golda, marami kasi mga subscribers na nag-ask regarding nursing home. So sana may ma-impart ka mga information about it.
I actually had the interview for the nursing home last February 2015. So,
2015.
5 years ago. Oo. So, at that time, Ireland was only starting to hire back again. Kasi there was a time na
recession ng ano.
Oo, nag-recession. Nag-stop sila ng hiring. Tapos I think it was only in around 2014 to 2015 na nag-start ulit silang mag-hire ng mga nurses. I was lucky to be part of an interview in the Philippines and it so happened that the opportunity was for a nursing home. So actually, I started in the nursing home when I started as a nurse here in Ireland.
Pero ano talaga yung ano mo? Specialty mo sa Pilipinas?
I was working in the government hospital for 5 years. So, 3 years no, nasa emergency department ako. Alam mo naman sa Pilipinas, di ba, we were kind of like rotated every 6 months sa mga wards. Pero in the last 3 years before akong nag-abroad, I was in the emergency department.
Bago ka nagpunta sa interview, wala kang second thought na, ay, nursing home?
So,
parang
ano yun? So actually, no, like most of us, I think most of us Filipino nurses would understand na habang tumatagal na nasa Pilipinas ka, hindi naman sa naboboard ka, pero you kind of like think about other opportunities. So, di ba? Normal naman yan. Walang masama doon. I mean, if you've been working in the Philippines, no matter how long, how short, it's still up to you kung gusto mo mag-abroad or hindi. It so happened at that time, there was an opportunity for an interview in Cebu, Philippines.
So, Cebuana siya dahil.
Actually, I'm from Bukidnon. So, Malaybalay City, Bukidnon. Shout out sa mga taga-Bukid, mga Bisaya. Kamusta mong tanan? Anyway, diba? Grabe, no? So, grabing segue. So anyway, but my mom is from Bulacan. So I had the interview in 2015 sa Cebu. So it was for a nursing home. To be honest, at that time, even ng country na Ireland, wala akong idea.
Same here.
No idea. Natatandaan ko pa, tinanong ako sa interview,
How did you come to know about Ireland?
ang sagot ko, I actually Googled it.
Very honest and they want that actually.
Fast forward to that. So I had the interview, I made it to the interview. Actually, nung nag-interview ako, wala pa akong IELTS na.
Yeah, ganun naman usually before, no?
Kasi nga,
shortlist ka muna.
True, kasi at that time, yun nga ako kakasimula pa lang ng Ireland. So, most of us nag-walk-in lang, ganyan. So, binigyan kami ng time na mag-IELTS exam. That's when we started applying for the NMBI PAC. Nakarating ako ng Ireland June 2016.
Pero may special qualifications ba silang hinanap sa'yo?
Actually, when we were applying, the only thing that was in the job description was a general nurse. When you're applying from overseas going to Ireland, ang talagang item na hinahanap nila is general nurse. Yeah. As long as you've had your 1-year experience, so minimum of 1-year experience as per the NMBI guidelines.
Exactly, yeah.
So it's all the same. Hindi nga nagmamatter kung saang area ka galing. Given na yon na alam mo yung fundamentals of nursing, just the basic nursing pin that you have. Kumbaga, yun ang ginagawa natin. We've been rotated to a lot of areas basically. So it doesn't matter what area you're coming from. Walang specific qualification as long as you've finished your nursing assessment with the NMBI.
For sure curious sila. Ano bang setting?
Paano
ba yung workload?
What is the nursing home, diba? At that time, when you hear the word nursing home, talagang isipin mo, matatanda.
Parang home for the aged.
Home for the aged, ganyan. So, magpapaligo ng matanda, mag-change ng pad ng matanda. So, yun yung common thoughts when you hear the word nursing home. So, when I came here, and then I started working, unti-unting nagkaroon ng pagkalawak yung isipan ko about the nursing home setting because it's actually more than taking care of the elderly.
Exactly.
Working in the nursing home for me at that time was a good jump start for my nursing career here in Ireland. Most of us Filipinos would have very good command in the English
language, yeah.
But then when I worked in the nursing home, I was caring for elderly people. Yung way ng pagsasalita nila, dun din ako medyo nahasa na parang, uy, kumbaga nagkaroon ako ng, alam mo yun, nagkaroon ako ng ear for the accent. Na-train akong makinig sa how they talk.
They say something,
How
express
they talk
themselves.
here.
mga ganyan.
Oo. So, naging magandang start siya for me. Not just the language, but the culture. You're looking after, like, maximum number of patients would be 20 in a floor. Yeah.
Per nurse.
So actually, the nursing home setting is kind of like not really a ward setting. Homey kasi siya eh. So you're the nurse, you're the head of the unit.
Okay.
And you have healthcare assistants. So yung tinatawag natin sa Pilipinas na parang nursing
NA.
aid, NA, tawag nila dito healthcare assistants. So more or less sila yung under sa'yo and they are the ones looking after yung basic needs ng pasyente, hygiene. Ang nurse, ikaw ang nagbibigay ng gamot nila and your healthcare assistants are there to look after, bedside care needs. But it's not stopping there. So as the nurse, syempre, ikaw pa din talaga yung head ng unit na yun.
Dito sa Ireland, usually, kapag sa ibang mga county sila, iba-iba din yung mga
Iba yung accent nila. Oo, so,
number one na
dun
yan
Oo, so medyo thankful ako na nag-start ako sa nursing home. Kasi nga,
Nahasa talaga siya.
exactly. So, it was a big help kasi hindi ako nagkaroon ng problema in adjusting to their language, to the culture per se. And then sa nursing home kasi, our focus is really the care of the patient. Mind you guys, when you're in the nursing home, you're really looking after the general, like, overall
Holistic
care.
approach.
Holistic
kumbaga.
approach of the patient. Hindi katulad sa hospital na acute setting kasi yun eh. So, if you say acute setting, you're really minding yung problema.
Sick people din.
Sick people. Sa nursing home kasi, you have to treat it as their home. So, kumbaga, nandun ka lang, kahit nandun ka, nurse ka, pero ang tingin mo sa nursing home is bahay.
And I believe you will master like yung communication with other disciplines then for sure.
Exactly. So, it's not just the nurses that are at work in the nursing home. Meron tayong tinatawag na MDT or yung multidisciplinary team. So, sa nursing home din, nandun din yung, so, na-mention ko na kanina yung nurses, nurses, the healthcare assistants, and we also have what we call the MDTs or the multidisciplinary team composed of your GP or your general practitioner, your PHN or the public health nurse, and you have your physiotherapist, the occupational therapist,
Dami, guys.
the dietitians, and the speech and language therapist. So actually, very holistic ang approach kapag pasyente na nilulook after sa nursing home.
Alam mo, ngayon ko lang na-realize na yung being a nursing home nurse, masyadong broad, at the same time, specific in some terms. Especially communication. Kasi I'm working in a hospital. Never ko naman na-experience na makipag-communicate sa mga outside doctors or outside nurses. Napakagandang experience.
Yes, exactly. And at the same time, you also include in the care of the patient's family. So, kasi nga diba nursing home siya. So, expect more visitors coming from the families. Dahil you have to treat it as a home, kumbaga, they're free to come in and visit their relatives na nasa nursing home. Kaya magandang practice siya of like, sinabi mo na yung communication. But it's not limited to care of the elderly. Sometimes we could have patients coming in with debilitating disease that needs 24/7 nursing care. So minsan it doesn't matter kung anong edad nila, kung sobrang tanda na ba nila or hindi. So but because they need 24/7 kind of nursing care na hindi naman necessarily nga nasa hospital siya i-care for, pwede siyang ilagay sa nursing home.
I'm sure curious din sila salary-wise. Okay ba sa nursing home? Or...
Oo nga, madaming nagtatanong.
Diba?
So, syempre naman, it's a common question. It's a good question, by the way. Hindi naman siya, ano ba, saan ng magandang sweldo, ganyan. So, actually, guys, here in Ireland, we have the government institutions and the private institutions. So, most private institutions, which is most nursing homes, are owned privately. They have their own salary compensation. Hindi kasi siya HSE rate na tinatawag nila. Kumbaga, they have their own rate na which is competitive din naman sa HSE rate. It's just so happen na yung HSE rate, kasi I think yung HSE rate, they based it on your
Years of experience.
years of experience. So, meron din namang nursing home na nagbe-base doon, pero they have their own rate na competitive din naman sa salary ng hospital.
And also, I just wanna ask, curious lang din ako, any memorable experience sa nursing
Oh
home?
my gosh.
Can you name a few if you don't mind?
Sobrang dami. Maraming tumatak sa isip ko na memories in the nursing home. Some good, some bad, some funny, like all other experiences in the nursing field. So expect a lot of people with behavioral challenges, dementia,
Cognitive
and
deficits.
cognitive impairment, cognitive deficits. Pero you have to take it as a learning experience every time. So, nagkaroon ako ng pasyente noon na mag-asawa sila and they're both in the nursing home.
Oh.
Yeah. So, the notebook ang pwede. The notebook. So, the husband was the one that is very sick. And then the wife came in after he got sick. Kasi nga, syempre, sila na lang naglo-look after sa sarili. That kind of experience, kasi sa Pilipinas, hindi siya common. It's not a common type of experience. Just being there in that kind of experience na you're looking after two elderly couples na kumbaga, andyan din naman yung family nila. It just so happened that they had to be there. They had to be looked after in the nursing home. So, alam mo yun, parang it kind of like brings out yung family-oriented side mo. Alam mo yun. So, it was so nice kasi
And it wasn't difficult for us, lalo na kasi we are very, you know,
So,
it's extended family.
It was memorable for me because so the husband was very
Teary-eyed
sick.
ka.
Oo, medyo teary-eyed ako. Ganyan. Pero it was so memorable kasi like it's not sad but it was beautiful. Kasi alam mo yung parang the husband was sick and then the wife came in, but then we had to look after her as well. Very privileged to be in that kind of caring environment. So kumbaga, in-involve namin yung family sa care nila. So it was very memorable and just to be there, just to touch lives. O, diba? Char.
Exactly. Medyo napaiyak ka doon ng konti.
Oo, medyo na-teary-eyed ako, pero it was a beautiful, beautiful experience. Alam mo yun, parang lolo at lola mo din.
Exactly.
Oo, so nakakatuwa kasi
usually mga long-term patients
long-term
nandun,
patients, you really get to know each of them.
Really establish rapport and relationship.
That's true. Pasok yung teamwork ngayon. So if you're really, if you work well with your team of healthcare assistants, it will really make the job very, very easy.
Na-mention mo kanina 1 to 20.
Yes.
But you're not alone naman. May healthcare
Of
assistant ka
course. So,
kasama.
hindi naman siya, ikaw lahat, shoulder mo lahat ng responsibility. No. As what I've said, it is a team approach. So, meron kang healthcare assistants, you have all these other people that will help you care for the patient. So, hindi lang naman ikaw.
You're the captain, kumbaga.
You're the captain of the ship.
Pero
ganyan.
paano yan? In terms of like documentation, do they have their own charts?
Yeah,
Do we
so
document?
depends on what type of nursing home. So most nursing homes these days, as what I've heard from other friends as well, computerized na kasi yung documentation. Oo. So in my experience, in my past experience in the nursing home that I worked in, meron kaming sariling tablet.
So computerized pa rin?
Computerized. Nandun na lahat ng nurses' notes. Nandun na din yung Cardex. So kapag nagra-rounds kami, nag-give ng medication rounds, naka-tablet lang siya.
So ganun ka na lang, ganun.
Oo,
Swipe
ganun ka lang, swipe, ganyan, or click mo lang pag
That's
nag-give mo
nice.
na yung medication. So, depends kung saang nursing home kayo nag-work. Pero,
That's nice.
it makes the job a little bit easier.
Exactly.
Ganun siya.
So ngayon, Golda, to sum it up, ano yung pwede mo maibigay na advices sa kanila or any tips? Kasi for sure, marami dyan na medyo parang nagsa-second thought to go to the nursing home. What can you say about
Okay,
it?
so, general advice or general
Yeah,
tip
I think,
probably,
ganun na
especially
lang.
for those na may opportunity that will be working in a nursing home. So, para lang sa akin, take it as an opportunity because, you know, everything is an opportunity.
Exactly.
You know, it's all a matter of perspective. It doesn't make you less of a nurse if you work in a
totoo.
nursing home. It will really test your basic nursing knowledge. If you're working in the nursing home, how you're going to prioritize things, how you're going to do general nursing assessment. Kasi hindi all the time may doctor sa nursing home. So ang akin lang, ma-advise ko lang sa kanila, if you're happy with that kind of opportunity, go and take it because it is a very good learning experience. It's a very good jump start to your career here in Ireland. I think I was successful in learning a lot of things in the nursing home in terms of being as a nurse, in terms of learning about the culture, practicing the kind of communication that they have here.
Exactly.
Great things are bound to happen, and if you have that kind of opportunity, why
Always
not?
grab the opportunity,
Exactly.
guys.
Why not try it?
So I hope marami kayo natutunan sa topic natin ngayon about nursing home. And by the way, si Golda is one of the moderators sa Filipino Nurses in Ireland. So please follow that page. Yung link, I will post that down below. So if you have any comments or any queries, just, comment.
If you have any other experiences, especially for the nurses,
We want to hear that. I think that's about it. Thank you again,
Yeah.
Golda,
Thank you.
sa
Thank
time
you so
na to.
much.
Thank you so much sa ulitin. As she said, just grab every opportunity that is there before you guys. So that's it. God bless, and I'll see you soon.
Bye.